Hello friends and welcome to StudyIQ. I am Joy C. Joy and today in this lecture we will discuss about common goods for health. So let us see what is common goods for health. This is an initiative of the WHO or the World Health Organization. So common goods for health, they are population based functions or population based interventions that require the collective effort of the government and various other stakeholders. So these are basically interventions or functions based on the size of the population. So here the size of the population is considered, and these are population based functions or interventions that require collective financing from government, from other stakeholders like the donors, etc. And this contribution is made towards the progress in health and also the well-being. So for getting progress or for attaining progress in health or well-being, a collective contribution of government as well as other stakeholders based on population. This is called common goods for health. You will get a better idea of what is common goods for health as we move on with the lecture. When we understand this concept in depth, you will get better idea. Now from your UPSC perspective, this is a very important topic. In your prelims examination, a direct question can be asked. The term common goods for health is referred in which context, or it was in the current affair in which context. So first thing you must understand is that this is a WHO World Health Organization initiative. Second one, the contribution or the intervention is based on the population size. So these two things are very important. And in your mains, questions can be asked regarding improvement of health infrastructure in the country or improvement in healthcare facilities in the country, etc. So in such type of questions also you can mention about the common goods for health initiative of the World Health Organization. So from both these perspectives, this is a very important topic. Now let us come to the current affair. Let us see what is the current affair. The Common Goods for Health, the CGH, is a project launched by the WHO. So this is a project launched by WHO or the World Health Organization. And through this project, the CGH or Common Goods for Health project, more pressure will be now put on the governments in order to do more based on the size of the population. So based on the population size, the interventions has to be made. So this is the current affair. Now let us understand CGH in detail. Now we have already seen in the introduction what is CGH. This is a population based or population size based intervention, and it is introduced by the WHO, the World Health Organization. So what is the purpose and the aim of CGH? The aim or the purpose of CGH is to bring in population scale public health. Now what is meant by population scale public health? So population scale public health means that the provision of public health facilities in proportion to the size of the population. So the government intervention or government initiative should be based on the size of the population. So this is called CGH. When we understand the details of CGH, we will understand that this project of WHO is actually trying to cover the market failure of healthcare sector or public healthcare. Now, when we talk about public healthcare, it is the healthcare provision provided by any government. It is called a private healthcare. Now, how does CGH tries to cover the drawbacks or the failures of the public healthcare system? The first one is that the public healthcare means it is a public good, that is a good that is provided by the government. Now second thing is that public healthcare system does not address externalities. So these are the two failures. Now first thing, it is provided as a commodity or as a good. Now second thing, it does not cover externalities. Now in order to understand this better, I will give you an example. Externalities, for example, let us take air pollution in Delhi. So air pollution is a negative externality. Now, it is definite that there can be health consequences due to air pollution or due to the bad quality of air in Delhi. So, definitely there are negative consequences which are called the negative externalities. So, this externalities cause serious health issues, especially respiratory issues in the population living in Delhi and surrounding areas. Now, what is to be understood here is that the public healthcare provisions does not address these externalities on like reducing the air pollution. These things are not addressed by the public healthcare system. It is merely looking into prevention as well as cure. So prevention to a smaller extent and main focus is given to cure. But the factors that caused the disease or the health condition, those externalities are not addressed. But when we look into CGH, it addresses those issues as well. Towards the end of this lecture, you will also understand how does CGH take care of these externalities as well. So this is to be understood that externalities are also taken care by CGH. Now, the CGH or the common goods for health also avoids the near universal confusion. Now, what is the confusion? The confusion is related to terms like public health, public good, public health expenditure. So, there are confusions regarding what are the differences between all these. What is public health? What is public good? Public health expenditure. So it avoids those dilemmas or confusions regarding these terms as well. This is because it brings a universal approach towards healthcare. So this is CGH in brief, and towards the end of this lecture you will get a clear understanding about the functioning and the status of CGH. Now let us see what is the need now, what is to be done. Now according to the WHO, World Health Organization, there is a need to do more on CGH, the common goods for health. This is because CGH is a concept which is based on the population size. So the CGH is based on the size of the population. Now when CGH is considering the size of population, the interventions or the functions or the government activities are also related to the size of the population. So population size interventions will definitely reduce the disease burden. So CGH will definitely reduce the disease burden because this is based on the size of the population. Now secondly, CGH will also address threats like pandemics, externalities like pollution, air quality. Now thirdly, this will also address those drawbacks in the public health system in India. Now fourth thing is that since it is based on population scale, the interventions will be based on the size of the population. So since the interventions are based on the size of the population, in case of India, where the population is very high, this will compel the government in order to spend more. So the fiscal expenditure on healthcare will improve or increase because this is a population based intervention. Now another thing is that this will also address the debate on prevention versus health. This is because when we look at the public healthcare system, the public healthcare system mainly focuses on cure rather than prevention or health. So the main focus is on curing of diseases. But the CGH will address all these issues. That is why we need the CGH or the common goods for health. Now let us see why should we strengthen the foundations of public health. Why do we need to strengthen it? The first reason is the prevalence of global pandemics like Ebola. Now what is meant by a pandemic? A pandemic refers to a disease that is spread across a large region, that is in multiple continents, in multiple places. So this is an epidemic that is spread in a large area or on a large scale. So there is a high prevalence of global pandemics like Ebola. So in order to deal with this, we need to strengthen the foundations of public health care. Now, second one is the prevalence of externalities. Now, when we talk especially about India, we have externalities mainly in the form of pollution, especially the quality of air, that is the air pollution. So, these externalities have got their own health consequences, and this needs to be addressed. Now, third one is that the environmental degradation caused due to many factors, and this environmental degradation which in turn leads to a climate change, and the climate change and environmental degradation together, clubbed together, how they cause diseases or how do they cause healthcare issues. So these are some issues existing. So all this together will have adverse impact on the population. So that is why we really need to combat these diseases or these problems from the root level onwards. Now, what does the public health care do? The public health care system will actually focus on the health care. It only focuses on health care, but they will not cure the root cause of it. So if we need to solve the root of it, the root cause of it, then we really need to strengthen the public healthcare facilities. The reason why the public healthcare is focusing only on health, not on curing or not on dealing with the root cause, the reason is that the government and the politics, the governance and the political systems, they prioritize urgent to important or urgent over important. Now, what is urgent? Cure is urgent. When there is an pandemics or when there is a epidemic, then it has to be cured. This is the urgent priority. But important, what is more important? Importance is for prevention. So importance has to be given to prevention, whereas the urgent requirement is to cure. So the government or the political system is giving importance to what is urgent rather than what is important. Now let us see what is the connection of CGH with that of public finance. The improvements in the public health will definitely reduce the extent to which people get sick. So when the public health services improves, this means lesser people will get sick. So this means that there is reduced healthcare expenditure. So even though the CGH, it is a population sized based project, in the long run this will definitely bring down the healthcare expenditure. This is because with CGH the public health system will improve. So this will definitely bring down the number of people who get sick. In the long run this will result into reduced healthcare expenditures. Now, secondly, this will also reduce the fiscal burden associated with the government programs that pay for the healthcare. This means over a long period of time, this will definitely reduce the fiscal burden of the government as well. Now, how does this happen? Now, let us take an example where the government is spending so much of money on insurance, but it is not sure that government, by merely spending money on insurance or on insurance companies, that the health condition of the population will improve. This is because only if the payments of the government is in parallel to or in proportion to the healthcare events, then it becomes effective. So we cannot say that merely providing insurance can be efficient. Now, secondly, the CGH will also act as a universal health coverage facility, because whatever actions or interventions the government is undertaking or any economy is undertaking under CGH, this will be applicable or this will be done for everyone, beneficial for everyone. So this will definitely provide a universal health coverage benefit. Let us take an example. The government is putting in certain efforts to reduce the air pollution levels or to improve the quality of the air. Now, this is as a part of CGH. So this has a universal coverage because it is not just some people who are going to benefit, but the target group as a whole will benefit out of it. So this will also provide a universal health coverage. Let us come to the status of health expenditure or public health care in India. Now, when we look into India and India's spending, public spending on healthcare, we will see that the fiscal exposure to healthcare expenses has sharply risen in last few years in India, and this is because of the introduction of government sponsored health insurance schemes. So the government has introduced health insurance schemes, and this has sharply increased the fiscal exposure or the government expenditure for healthcare. At the same time, this increased fiscal expenditure or government expenditure on healthcare has also raised concerns about the magnitude of debt created by the government for health expenditure. But CGH will help the government in reducing the expenditure. We have already discussed how CGH will help the government in reducing the expenditure. This is because when the government is making interventions based on population, definitely this is going to bring down the number of people who get sick. So in a phased manner, government will be able to cut down its expenditure on health sector. And secondly, the government will also be able to reduce the financial risk associated with the schemes that the government provide, the healthcare schemes that the government provide. Third thing, the CGH will also cut across many ministries. That means many ministries will be involved in the CGH. We have seen that it not only addresses the health issues like curing certain diseases, but it also focuses on prevention. So, for example, air pollution. This is a concern of the Environmental Ministry, Ministry of Environment and associated departments. CGH will make it sure that there is coordination and cooperation between different ministries and departments and government agencies. So those issues which have got health consequences, for example air pollution or road accidents, road safety, so these are all not the concerns of the health department, but it has got consequences on the health of people, which has got an impact on the health department or health ministry. So here it is made sure that different departments work together in cooperation and coordination. So this will lead to a coordination and cooperation mechanism. So this is about CGH, that is Common Goods for Health, which is a project of WHO. You can find the PDF of this lecture on our website www.studyiq.com. You can also follow my Facebook page for more video updates. You can write to me at joycey.studyiq@gmail.com for any of your queries and clarification. Thank you.